Well, professors Melissa Graboyes and Alfredo Burlando, thank you so much for talking. I know you're a captive audience right now, but I appreciate you taking time to talk to me today.
Thanks for having us.
Thank you.
How are you holding up, and can you tell Oregonians kind of where you are physically and how long you've been, cooped up inside?
So we started about 3 weeks ago, where we left our apartment in Milan. So we've been living there since this summer, when we left Eugene to spend a year living in Italy while on a research leave from the University of Oregon. So when local transmission started about 3 weeks ago, we packed up what we needed in a few suitcases and left Milan. So since then, we've been in 2 different spots, 2 different houses, and are now fully locked in to house isolation, which is required by all Italians for at least the next 2 weeks.
How have you been managing this? It's incredibly stressful, I'd imagine, to be overseas, as well as with your small children and trying to navigate all of this.
Yeah, I think that it has been somewhat stressful, but we have some inherent advantages. I'm Italian and my family is here. And so what we have been able to do is really rely strongly on the family ties and the family networks. Obviously, the kids in Milano, they were enrolled in school, and so that has had to stop. We've been dealing with the schools indirectly via email communication and WhatsApp, getting homework, and somewhat loosely remaining connected with the school. And that probably is the biggest challenge, is how to keep these kids motivated through weeks without school, and what does it mean really for their learning.
Well, and it will probably be months at the end. So
yeah,
I was just going to say, Alfredo is the Italian, so he's going to tell you the upside of being back in his hometown. But I'm the resident warrior, planner, and public health expert in the family.
Exactly.
And I will say that the last 3 weeks have been extremely stressful, not just for the logistics of managing where to go and decision making, but the situation has been changing so rapidly. I mean, we look at the data, and both of us are comfortable looking at quantitative data and figuring out what it means. And we're looking at epidemiological data multiple times a day, trying to figure out what's the rate of change, how many tests are being done, how many new cases are popping up, where are they, how full are hospitals, trying to make informed decisions about where should we be. And even with support networks in place, it's really a confusing, stressful time to trying to figure out what you as an individual should do.
My family, my parents are still, they're in the early 60s, and so they are alive. We are concerned about them as well, even though they're very healthy. So you think, I could not imagine them sick, but on the other hand, there's a lot of people that you don't imagine sick that end up being sick. And so we are trying to convince them actually to take some protective behaviors. And one thing that I find very striking here in Italy is that there is obviously a lot of, it's an old society. There's a lot of old people, and they tend to be less likely to take safe behaviors. They are the ones that are walking through the supermarkets without wearing gloves. I asked my aunt if I could go shopping for her, and so she could stay home. And her response is, well, if you're going to be outside, let's meet at a bar so we can have a drink together and go on a stroll. And clearly that was not the intent that I had.
We agreed when we arrived here 2 weeks ago that children were not going to go out in public places anymore. They're too unreliable. They put their tongues on everything. They put their hands on everything. They touch their face. They're germ monsters. And they're also really amazing vectors of this disease. So they don't often show symptoms. But once a child has that disease, has coronavirus in the home, it's almost guaranteed that everyone in the nuclear family will get it just through regular home-based care for fever, for taking care of a moderately mild sick child. So for us, we decided kids are not going in public. We also minimized all adult contact in public. We tried to do grocery shopping together so only one adult would go out. We do have masks and gloves, and when I go out in public, I use those, not because they filter the virus, but because it stops me from touching my nose and my mouth. And it's a good reminder to make sure that surfaces that I touch are likely dirty.
you know, you were going to be studying malaria, is that right? Or writing about malaria? Or are you kind of tacking and thinking, hey, what's happening to us and what's happening all around us is something I want to do more research on?
One of those questions that I'm really interested in is, how does scientific knowledge and learning get transferred from one place to another? So what I've seen is some really significant barriers in learning and knowledge being transmitted from China to Italy, from South Korea to Italy, from Italy to the United States, from Italy to other countries in Europe. And I find that really striking because it's the same disease. The same techniques could be used, the same diagnostic tests could be used, but countries are approaching it so differently that there's clearly some real barriers to figuring out how do you share knowledge in the midst of an epidemic and an emergency situation.